Climate factors influencing chikungunya are temperature, humidity, altitude, precipitation. False answer wind. Climate factor example household container pools, hot, humid rainy season. A cohort study may be open, closed, fixed. False answer antagonist, homologous. Types of cohort: closed or fixed, open or dynamic cohort. Database management model may be hierarchical, relational. False answer medium, diagonal, historical. Different types of data models: flat data model, entity relationship model, relation model, record based model, network model, hierarchical model. Object oriented data model, object relation model, semi structured model, associative model, context data model. Levels of disaster are featured by level 1 wants support from community level, level 2 wants support from national level, level 4 wants support from international level. False answer level 3 wants support from regional level, level 5 wants support from provincial level. Disaster management level 1 district, level 2 state, level 3 central. Level 1 localized incident, controllable and has no probability to spread. Disaster managed by the authorities at the district level. Level 2 incident covering 2 or more districts but no potential to spread. Coordinate assistance at the state levels to the affected districts. Level 3 complex and covering wide area or more than 2 states, greater financial, human resources and assets coordination. Data collection instruments include true answer structured questionnaire, checklist, microscope, medical record. False answer K2 guideline. Data collection instrument. আচ্ছা tools এর আন্ডারে আই অ্যান্ড আদার সেন্স, পেন, পেপার, স্কেল, মাইক্রোস্কোপ, ভিডিওটেপ, ফিল্ম, রেটিং স্কেল, চেকলিস্ট, ইনস্ট্রুমেন্ট, ইন্টারভিউ শিডিউল, টেপ রেকর্ডার, চেকলিস্ট, কোশ্চেনিয়ার, টেলিফোন সেট, কোশ্চেনিয়ার শিডিউল, ডাটা কালেকশন শিট or recording form, like scale, visual, analog scale. Data collection method: observation, counting, measurement, experimentation, interview, administering questionnaire or schedule, review of record documents, questioning. Philosophy of SDG concerns universal healthcare, human rights, transformation, universality. False answer equity. SDG focus on people, planet, policy, human condition. People, basic human right, planet, and acceptable and sustainable planet, including the state of natural resources and environment. Policy, collaboration among policy makers to create conditions for a fair and equitable global society. The human condition, essential societal and health issue. essential social and health issue. People are under a gender equality, no hunger, no poverty. Planet are under a climate action, life below water, life on land. Policy are under a peace and justice, reduce inequalities. Human condition are under a good health, good job, economic growth, quality education. A conceptual framework denotes causal association, confounding effect, intervening effect, false answer, prediction of association, direction of association. Independent and dependent variable, hours of study, independent variable, exam score, dependent variable, moderating variable, mediating variable, moderator versus mediator, control variable. Moderating variable, hours of study, independent variable, IQ, moderator variable, exam score, dependent variable. Mediating variable, hours of study, independent variable, a number of practice problem completed, mediator variable, then exam score, dependent variable. Moderator versus mediator, control variable, health control variable, hours of study, dependent variable, exam score, dependent variable. Estimates of retrospective study include odds ratio, risk difference, cross product ratio, false answer, incidence rate, risk ratio. কেস কন্ট্রোল স্টাডি, কোহোর্ট স্টাডি। কেস কন্ট্রোল হচ্ছে আউটকাম বেসড, এটা হচ্ছে এক্সপোজার বেসড, ইউজুয়ালি রেট্রোস্পেক্টিভ, এটা হচ্ছে ইউজুয়ালি প্রসপেক্টিভ। কেস উইথ আউটকাম অ্যান্ড উইথাউট আউটকাম, কেসেস উইথ এক্সপোজড গ্রুপ অ্যান্ড আনএক্সপোজড গ্রুপ, স্যাম্পল সাইজ স্মল, এটার ক্ষেত্রে লার্জ। Population with outcome and without outcome, population free from outcome but with exposed and without with exposed and without exposed. Compare prevalence of exposure between case and control, compare incidence rates of outcome in exposed and unexposed, measurement odds ratio, measurement relative risk. আচ্ছা, এটার ক্ষেত্রে ওআর আর এটার ক্ষেত্রে আরআর। ICD-10 codes for to answer signs and symptoms, complaints, social circumstances, false answer, disability, deformity. ICD-10, it covers disease, illness, injuries, classification list, nomenclature, definition, instruction, manual, alphabetical index, new disease of uncertain etiology used in research. Community diagnosis techniques are community based meta analysis, community surveillance, community action research, community registration. False answer, community counseling. Framework for community diagnosis, sources of information and the methods that can be used for community diagnosis. Routine reporting from health facilities, surveillance, active and passive and sentinel surveillance, screening of the community, survey, vital registration of event. Prion diseases are caused by true answer, infectious protein, false answer, microorganism, abnormally folded protein, neurotoxin, endocrine disruptors. Prions are infectious particles composed entirely of protein, can infect human or animal. They have no RNA or DNA, no nucleic acid. They are encoded by a cellular gene. The function of the normal prior protein unclear. One of the signal transduction proteins in neurons. It is highly resistant to inactivation by ultraviolet light, heat, formaldehyde, and nucleases and other inactivating agents. The functions of the normal prior protein unclear. One of the signal transduction proteins in neurons. It is highly resistant to inactivation by ultraviolet light, heat, formaldehyde, and nucleases and other inactivating agent. Electron microscope, filamentous rod or amyloid like inactivated by hydrochloride, NaOH, autoclaving, transmitted by human growth hormone and neurosurgical instruments. They are normal human protein. They do not elicit an inflammatory response or an antibody. Disease in human. CRU, TZFELDT. Jacob disease, fatal familial and sporadic insomnia, Kuru, transmissible spongium, encephalitis, Gerstmann, Strauss, Schinker disease. Primary healthcare related declarations are Astana Declaration, false answer Madrid Declaration, Geneva Declaration, Riga Declaration, Bandung Declaration. Primary healthcare related declarations are Astana Declaration, Madrid Declaration, Geneva Declaration, Riga Declaration, Bandung Declaration. Barefoot doctor was a concept of Chinese medicine. False answer 2700 BC, Greek medicine, Indian medicine 2100 BC. Manifest variable includes to answer IQ, knowledge, intelligence. IQ, intelligence, knowledge. For manifest variable include IQ, intelligence, knowledge. False answer efficiency, skill. Efficiency skill হচ্ছে latent variable. Manifest variable কি? A manifest variable is a variable or factor that can be directly measured or observed. It is opposite of latent variable. Features of complementary goods are negative cross elasticity of demand. Demand for a good decreases if price of another good increases. Demand for a good increases if the price of another good decreases. False answer negative cross elasticity of supply. Demand for a good increase if price of another good increases. What is complementary foods? A complementary food or service is an item used in conjunction with another good or service. Complementary goods, the joint demand nature of a complementary goods causes an interplay between the consumer need for the second product as the price of the first product fluctuates. Qualitative data collection methods are focus group discussion, in-depth interview, Delphi technique, false answer record review, physical measurement. There are many types of qualitative method: the case control study, interview, observational technique. Focus group discussion, census method, Delphi technique. Focus group discussion, census method, Delphi technique. Revitalization of primary healthcare denotes true answer universal coverage, false answer collaborative effort, sheer conference of primary healthcare leadership reform, public policy reform. Bias is a true answer systemic error, false answer chance error, sampling error, random error, methodical error. A case report includes true answer abstract discussion, acknowledgement, false answer background abbreviation. And common components of case report: abstract, discussion, acknowledgement, introduction, case report, references, supplementary parts. Demography is based on true answer composition of population, distribution of population, false answer change in population, migration of population, mobility of population. Arthropods act as disease agent are true answer housefly, sandfly, itch mite, louse, mosquito. Arthropod-borne viruses are defined as viruses which are maintained in nature principally or to an important extent through biological transmission between susceptible vertebra hosts by hematophagous arthropods. Basic activities of management include organizing, controlling, communicating, for instance, executing, evaluating. Sequential function management, planning, organizing, staffing, directing, controlling, or continuous function, decision making, communicating. Long acting reversible contraceptive methods are true answer subdermal implant, intrauterine contraceptive devices, false answer hormonal oral pill, non scalpel vasectomy, the vasectomy barrier method. Components of behavioral science are true answer social, psychology, sociology, anthropology, false answer criminology, political science. And factors responsible for breast milk flow include health condition of mother, feelings of mother, false answer fluid intake, family support, age of the mother. Maternal factors, infant factors. Maternal factors, stress, anxiety may decrease production of milk, ejection reflex, separation of mother and child, hormonal imbalance, new pregnancy, insufficient breast tissue, surgery to the breast or nipple, mother who does not wake up, breast injury or bad breastfeeding position, misuse of the teat, poor nutrition of the mother. Using commercial infant formula or baby bottle, baby refusing to the breast, baby sleeping for long periods or that does not wake up, long periods between feedings, weak suction, short tongue frenulum. Opportunistic infections in HIV/AIDS, true answer tuberculosis, toxoplasmosis, cryptococcosis, false answer actinomycosis, leptospirosis. Opportunistic infections in HIV patient, candida esophagitis, cryptococcus meningitis, vaginal candidiasis, coccidioidomycosis, cryptosporidiosis, histoplasmosis, pneumocystis carinii, toxoplasma gondii, tuberculosis, herpes simplex, herpes zoster, CMV retinitis, CNS lymphoma, Kaposi sarcoma, hairy leukoplakia. মেইনলি হচ্ছে ফাঙ্গাল, প্যারাসাইটিক, ব্যাকটেরিয়াল, ভাইরাল যত ইনফেকশন আছে সবই এইডস পেশেন্টদের হতে পারে। Causes an opportunistic infection in AIDS patient due to reduction in number of the T helper cell count. At-risk infants are identified by true answer working parent, artificial feeding, false answer congenital defect, birth order 2 or more HIV infected parent. Identification of at-risk infant, birth weight less than 2.5 kg, twin, birth order 5 or more, artificial feeding, weight below 70% of the expected weight, failure to gain weight during the 3 successive months, children with PEM, diarrhea, protein allergy, malnutrition, diarrhea, working mother, one parent. Characteristics of ideal complementary foods are true answer balanced, not frequent, tasty, energy dense, false answer costly. Qualities of complementary foods. Liquid at a starting, then semi-solid and solid foods to be introduced gradually, clean, fresh and hygienic so that no infection can occur, easy to prepare at home with the available food items and not costly, high in energy density and low in bulk, viscosity, and contains all nutrients necessary for the baby based on culture, practice and traditional belief, well balanced, nourishing and suitable for the infant. Vaccines contraindicated in pregnancy are true answer COVID-19 vaccine, varicella vaccine, MMR vaccine, false answer tetanus toxoid, hepatitis B vaccine. Population policy may be true answer implicit, explicit, false answer extrinsic, intrinsic, laissez-faire. Types of population policy in implicit, explicit, implicit. Disease under surveillance in Bangladesh are poliomyelitis, Nipah virus infection, false answer chikungunya, dengue fever, COVID-19. International quarantable disease, cholera, plague, yellow fever. International notifiable disease, smallpox, poliomyelitis, human influenza, SARS. Disease under surveillance, louse-borne typhus, relapsing fever, polio, influenza, malaria, rabies, salmonellosis. Insulin resistance syndrome is exacerbated by obesity. Increased sodium retention may result from a genetic defect. False answer contributes to low level of TG, produces insulin sensitivity. Chronic carrier is caused by true answer hepatitis B virus, Salmonella typhi, false answer Corynebacterium diphtheria, Plasmodium vivax, poliovirus. Chronic carrier infection, hepatitis B virus, enteric fever, malaria causing relapse and recrudescence, hepatitis C virus, neonatal rubella virus, cytomegalovirus, hantavirus, persistent viral infection, latent infection by virus, herpes viridae family, herpes simplex, varicella zoster, cell transformation, oncogenic virus, HIV infection, slow virus infection, lymphocytic, choriomeningitis virus, rubella, CMV, HBMV, HBV, adenovirus. Case fatality rate means killing power of disease, typical rate of chronic infection, false answer rate of deaths to cases, rate in a specified time interval, consequences of acute infection. Case fatality rate represents the killing power of the disease. Case fatality is typically used in acute infectious disease, food poisoning, cholera, measles. Its usefulness for chronic diseases is limited because the period from onset to death is long and variable. Case fatality rate or ratio is equal to total number of death due to particular case by total number of case due to the same disease into 100. Variable influence the causal pathway are intervening variable, confounding variable, moderating variable, false answer multi-component variable, biphasic variable. Risk of infection following sharp injury comprises HIV 1 in 300. False answer hepatitis B 5 জনে একজন, হেপাটাইটিস বি 15 জনে একজন, হেপাটাইটিস সি 50 জনে একজন, হেপাটাইটিস সি 5 জনে একজন। ট্রু আনসার হচ্ছে HIV প্রতি 300 জনে একজন। হেল্প হচ্ছে 1 in প্রতি 3 জনে একজন, হেপাটাইটিস বি প্রতি 30 জনে একজন, হেপাটাইটিস সি প্রতি 300 জনে একজন, HIV। Biosecurity in laboratory refers to measures to prevent theft of laboratory data designed to prevent intentional release of pathogens, identify the vulnerability of misuse of toxins. False answer only institutional security, scientific and laboratory personnel only. Biosecurity in laboratory refer to true answer measures to prevent theft of laboratory data designed to prevent intentional release of pathogens, identify the vulnerability of misuse of toxin. False answer only institutional security, scientific and laboratory personnel only. Attributes related to medical waste are true answer reduce and reuse are effective. Segregation is done after collection. False answer 80 থেকে 90% are infectious. Most of the wastes are hazardous. Yellow beans are used for liquid waste. % general healthcare waste which may be dealt with by the normal domestic and urban waste, 15% pathological infectious waste, 1% sharp waste, 3% chemical and pharmacological waste, less than 1% special waste such as radioactive or cytotoxic waste, pressurized containers or broken thermometer and used batteries. Between 75 to 90% of the waste produced by the healthcare providers is a non-risk or general healthcare waste. Human anatomical waste, incineration, animal waste, incineration, microbiological and biotechnology waste, chemical treatment, mutilation or shredding, landfill, recycle, wasted sharp chemical treatment or destruction by needle or tip cutlers, autoclaving or microwaving, mutilation or shredding, landfill or concrete sharp speed, discarded medicines and cytotoxic drugs, landfill or incineration, soiled waste, incineration, infectious and solid waste, chemical treatment or autoclaving, microwaving, the chemical treatment or autoclaving or microwaving, mutilation or shading, recycle, chemical waste, chemical treatment, disposal in drains. YOLO, incineration, red, chemical treatment or destruction, needle, tip, cutlers, autoclaving or microwaving, mutilation or shredding, landfill, recyclers or concrete sharp speed, blue, chemical treatment, disposal drain, black, municipal waste, municipal dump sites. Significance of antibiotic susceptibility testing includes provide appropriate treatment guidelines, monitor resistance development. AST must be done before treating ICU patient for cancer, identifying any new species of microbes, compare trends in healthcare facilities. Vitamins involved in RBC maturation are true answer folic acid, vitamin B12, false answer vitamin K, vitamin B1, vitamin E. Physiological motives include eating, sleeping, seeking shelter. False answer recreation, dominance. Primary motive hunger, thirst, sleep, temperature regulation, elimination, avoidance of pain, sex. Secondary motive gregariousness, curiosity, ambition, competition, aggression, interest, attitude. Statistical test used to compare two proportions are t-test, z-test. False answer chi-square test, ANOVA, sign test. Z-test, students, t-test. Statistical test, z-test, students, t-test. Comparative research study design includes cross-sectional study, false answer longitudinal study, cohort study, ecological study, field trial. Apply case control, cohort and cross-sectional study. Comparative research study includes case control, cohort, cross-sectional study. Human resources are maintained by providing compensation, paying wage, giving benefit, issuing appointment letter. Providing compensation, paying wage, giving benefit, issuing appointment letter. False answer fulfillment of need of employee. Material management is important in case of true answer delayed procurement, perfect anticipation of demand, pilferage and wastage, poor maintenance. Delayed procurement, perfect anticipation of demand, pilferage and wastage, poor maintenance. False answer low costing. Types of materials management include materials manager, inventory control manager, inventory analyst, material planner, expeditor, and emerging hybrid roles like buyer planner. The primary business objective of material management is assured supply of material, optimum inventory level, minimum deviation between planned and actual results. Non-parametric tests include true answer ANOVA, Wilcoxon signed rank test, Spearman rank correlation, false answer t-test, z-test. Non-parametric test, chi-square test, Fisher extract proportion, Fisher extract test, proportion test, Mann-Whitney test, Wilcoxon rank sum test, sign test, proportion test, Spearman rank correlation test, Kruskal-Wallis test, Friedman test. Objectives of quality health education should be relevant, equivalent, functions are feasible, measurable, non-specific. Principles of health education: credibility, interest, participation, motivation, comprehension, reinforcement, learning by doing, known to unknown, setting an example, good human relation, feedback, leader. 95% CI of mean helps to determine 95% CI of mean helps to determine the range where the sample mean has 95% probability. The range where the sample mean does not have 5% probability. False answer: exact value of population mean. The range where the population mean has 95% probability. The range where the population mean does not have 5% probability. CI means confidence interval. %95% confidence interval means probability of this CI to include the population parameter is 95% and not to include the population parameter is 5%. Coefficient of variation is needed to answer compare relative variability. False answer: compare the variation of the same character in different series. Compare the variation of the different character in same series expressed by the respective units. Express mean as a percentage of SD. Sampling error is caused by erroneous false answers are false observation, randomization, data processing, sampling, data analysis. Vital statistics include true answer birth, marriage, death, false answer migration, social mobility. Vital event হচ্ছে লাইভ বার্থ, ডেথ, ফিটাল ডেথ, ম্যারেজ, ডিভোর্স, অ্যাডপশন, লেজিটিমেশন, রিকগনিশন, অ্যানালমেন্ট, লিগ্যাল সেপারেশন. Nutrition cycle includes true answer bad nutritional status, proper intrafamilial food distribution, false answer food production is increased, less food consumption by family, work capacity is increased. Nutrition cycle includes bad nutritional status, proper intrafamilial food distribution, false answer food production is increased, less food consumption by family, work capacity is increased. A nutrient cycle or ecological recycling. Eating disorders are true answer bulimia nervosa, anorexia nervosa, binge eating disorder, false answer fasting, hyperemesis, gravidarum. Hyperemesis gravidarum. Types of eating disorder: anorexia nervosa, bulimia nervosa, binge eating disorder, rumination disorder, avoidant restrictive food intake disorder, orthorexia, diabulimia, OSFED, pica. Nutrients required for brain development are iodine, zinc, false answer folic acid, vitamin D, fibers. Key nutrients for brain development in early life: protein, polyunsaturated fatty acid, iron, zinc, copper, iodine, choline, folate, vitamin A, B6, B12. Effective measures for safety program are true answer education enhancement, false answer engineering enforcement establishment. Significance of antibiotic susceptibility testing AST includes true answer provide appropriate treatment guideline, monitor resistance development. AST must be done before treating ICU patient. False answer identifying any new species of microbes, compare trends in healthcare facilities. Vitamins involved in RBC maturation are true answer folic acid, vitamin B12, false answer vitamin K, vitamin B1, vitamin E. Components of total energy expenditure are thermic effect of food, physical activity, false answer resting membrane rate, body mass index, mid upper arm circumference. Total energy expenditure consists of four components: the sleeping metabolic rate SMR, the energy cost of arousal, the thermic effect of food and diet induced energy expenditure DEE, the energy cost of physical activity or AEE. SMR, DEE, AEE. স্লিপিং মেটাবলিক রেট আর হচ্ছে ডায়েট ইনডিউসড এনার্জি এক্সপেন্ডিচার, এনার্জি কস্ট অফ ফিজিক্যাল অ্যাক্টিভিটি. Consequences of lactose intolerance are abdominal discomfort, diarrhea. False answer malabsorption of nutrient, fever, rash. Sign symptom bloating, cramp, flatulence, diarrhea, nausea, borborygmy, vomiting, particularly in adolescent. These appear 1/2 to 2 hours after consumption. Elements of human personality are physical traits, intelligence, behavior. False answer motivation, religion and caste. Components of personality: physical, emotional, intelligence, behavior. Physical, emotional, intelligence, behavior. Four elements of good health and safety program: management, commitment and employee involvement, work site analysis, hazard prevention and control, training for employee, supervisor and managers. Occupational hazard is a source of danger of workplace, a life-threatening event for workers, a chance of harm to the workers. False answer an inherent toxicity of chemicals and the extent of exposure. Garbage disposal method is burning, incineration. False answer landfilling, sterilization, boiling. Principal method of refuse disposal are dumping, control tripping or sanitary landfill, incineration, composting, manure pits, burial. Randomized control trial is featured by to answer systemic randomization, triple blinding, controlling confound. False answer cluster randomization, selective manipulation. Intellectual disability may be caused by Down syndrome, phenylketonuria, Fragile X syndrome. False answer Tay-Sachs disease, Alzheimer disease. Media population. Sampling some of the most common causes of intellectual disability: Down syndrome, fetal alcohol syndrome, Fragile X syndrome, genetic condition, birth defect and infections. Media population can be calculated by true answer natural increase method. False answer arithmetic progression method, geometric protection method, life table method, demographic transition method. Median population is used as denominator in crude birth rate, crude death rate, disease specific death rate, sex specific death rate, age specific death rate, weekly death rate, general fertility rate, general marital fertility rate, age specific fertility rate, age specific marital fertility rate. Population research deals with true answer total population, country-wide survey, meta-analysis. False answer representative part of population, clinical trial. Vector indices for malaria estimation are true answer human blood index, inoculation rate. False answer parasite density index, proportional case rate, slight positive rate. Vector indices: human blood index, sporocyte rate, mosquito density, man biting rate, inoculation rate. Breast milk contains macrophages, lymphocyte, lactoferrin. False answer IgG monocyte. Gender equity means fairness of dealing for needs by gender, fairness of dealing for needs by gender, women empowerment, fairness of justice in sharing benefits between men and women. Gender equity means fairness of dealing for needs by gender, women empowerment, fairness of justice by sharing benefits between men and women. False answer: equal distribution of resources by gender, equal rights for both men and women. Equal distribution of resources by gender, equal rights for both men and women. Gender equity means true answer: fairness of dealing for needs by gender, women empowerment, fairness of justice in sharing benefits between men and women. Elements of health insurance are premium, co-insurance, deductible. False answer: adverse risk selection, moral hazard. The individual insured person's obligations may take several forms: premium, deductible, co-payment, co-insurance, exclusions, coverage limit, out-of-pocket maximum capitation, in-work provider, out-of-network provider, prior authorization, formulary. The list of drugs that an insurance plan agrees to cover, explanation of benefits. Basic elements in health insurance: risk management, administration, quality, premium, insurer, payment, provider, care, community. Modern concept of UNICEF includes child health, child education, child nutrition, child development. False answer: whole child. Content of service: child health, child nutrition, family and child welfare, education, formal and non-formal. Child health revolution: GOBIFFF, growth monitoring, oral rehydration, breastfeeding, immunization, female education, female family spacing, food fortification. GOBIFFF. Approaches of epidemiological measures are asking question, making comparison. False answer: describing magnitude, estimating risk, evaluating outcome. Semi-variable cost includes equipment cost, building cost, vehicle cost. False answer: drug cost, personnel cost. And what is semi-variable cost? Semi-variable cost has characteristics of both fixed cost and variable cost once a specific level of output is surpassed. Action plan on geriatric health includes Vienna action plan, Madrid action plan. False answer: Jakarta action plan, Helsinki action plan, Riga action plan. Types of cohort study are true answer: prospective study, longitudinal study. False answer: nested case control study, retrospective study, crossover study. Cost efficiency concerns, true answer: cost benefit, cost effectiveness, cost utility. False answer: cost containment, cost control. Minimization, effectiveness, benefit, utility analysis. Positive science deals with, true answer: normative evaluation, existing situation, current affairs. False answer: ethical assessment, prevailing practices. Phrases of research are design phase, analytical phase. False answer: inductive phase, deductive phase, ethical phase. Phases of research: the conceptual phase, design and planning phase, empirical phase, analytical phase, dissemination phase. Conceptual, design and planning, empirical, analytical, dissemination. Community treatment is focused on community diagnosis, community resources, community participation, false answer, community mobilization, community alliance. System software includes to answer operating system software, utility program, false answer, library program, SPSS application, STATA. Common types of system program: utility software, hypervisors, GNU, BIOS, multi-threading, biotech system, internal kernel programming, PSP, linkers, bootloaders. Health managers communicate to organize activities, negotiate future plan, improve predictability, false answer, motivate people, conduct medical audit. Medical legal issues related to aging and true answer, elder abuse, euthanasia, false answer, power of attorney, autonomy, geriatric essentials.